Good afternoon, ma'am, and my fellow classmates. Thank you for having me in this recorded presentation. So, I had made this recorded topic facilitation as a contingency in the event that I may not be able to report on the day of my scheduled uh, presentation, either to power outages or perhaps connectivity issues. No, so I'll be sending this video for ma'am to present in my behalf on the class. No, but hopefully, no, I can present this uh, synchronously. No, but in the event of difficulties, so I had made this in advance. So I do hope that through this modality, uh, I can be as effective, and hopefully I can give justice to this topic, and I maybe present it in a manner that will be insightful as well. So this presentation will be segmented into three parts. So I will allow briefers in between to allow the class and ma'am to also share inputs to solicit feedback based on the content and materials that I'll be sharing in class, and also to give opportunity for each one of us if we have any significant experiences related to the content that I am presenting. So I do hope that you are going to be with me and help me make this topic more constructive. No? So my topic is counseling substance users. So actually, the original title is alcoholics, drugs, and tobacco users. No, but since I think it will be more complicated if I'm going to deal them in a separate population. So, and because the literature is so extensive, so I had decided to just lump them as substance users. No? So how to better counsel and how to better facilitate this special population. So the flow of our discussion will be segmented into three parts. So the first, we will discuss on the background. No, what will be the context of our discussion on the special population with substance use disorders in the context of the drug situation, the illegal drugs in the country. And then we will focus on the nature of clients. What are the difficulties, the challenges, the issues that these clients endure and suffer, and by understanding these issues, we can properly design an intervention appropriate to the needs of these clients based on their present situation or based on their etiologies of substance use disorder. This will be followed by the counselor competency. No, so who is the most eligible to conduct uh, substance abuse counseling? What will be the most efficient competencies for a counselor to be more effective in terms of implementing interventions for these special populations? And then we will go with the interventions that are generally practiced. And for those evidence-based interventions that is currently implemented by our national government in the fight against drug problems in the country. And then the final part will be our conclusions, my personal takeaways from this uh, topic, as well as I'm going also to solicit your personal reflections and your personal take for this special population and the appropriate interventions. No, so let's dive in this topic. So first we have the background. No, so what is the situation in the Philippines? So I think this is very much well documented already in the media. No, although this was not this the drug problem no longer uh, spotlights the headlines because of the COVID pandemic, but I think most of us are already very much aware of the context of the drug problem and how it really compelled the government to do something about it. No? So, for context, here are some of the recent statistics, no, that I was able to pick up when I attended that webinar sponsored by the University of the Philippines together with the other academic stakeholders with PIDEA, DOH, and a lot of interagency collaboration. No? So here is the scope of the drug problem in the Philippines. 80% of the total barangays in the country were classified as drug affected. No? So you can just imagine the extent of that. But I don't know how many of these were already declared as drug-free barangays. Of course, there's also the question of how truthful is a barangay, uh, how truthful is the proclamation or the identification that it is a really a drug-free community. No, so there are those questions, but we will not go there. So that is just the context, no, of how serious the drug problem is and how it really affects, no, in a national, in a local, and individual scope. No, how does this problem continues to persist? No, in one of the keynote speakers during that webinar, he cited that there has not there is no significant reduction in the flow of illegal drugs in the country. No, so even though that there had been uh, sufficient or significant raids or law enforcement, but the demand is still present. That's why there is still continuous uh, inflow of illegal drugs in the country. No, but in fairness to the government, no, I think this is the one aspect that is not widely given coverage in the news. The government is actually doing something, believe it or not. And just for context, the government actually has a two-pronged approach. No, the most common and the most widely uh, covered in the media is the substance supply reduction. No? So this covers law enforcement, regulatory compliance, and the judicial and legislative measures. No? So this is the bulk of the work of the government, short term, no, short term and medium term approach of the government to reduce the flow of drugs so that it can help reduce also its adverse effects to the population. The other approach, which is actually more on the long term and actually which requires more effort, actually the one which is more costly, which requires a lot of participation. including from us, no, guidance practitioners, educators, and from all other sectors is the drug demand reduction. No, this is more on the long-term approach, and I think this drug demand reduction is the really solution, the real solution, long-term, uh, that is sustainable and has a higher probability of winning out the drug problem in the country. So this covers policy formulation, no, preventive education, especially in our schools, disseminating information campaign against the harmful effects of drugs, and strengthening the resistant attitude of our children, our students against using substance use or even experimenting substance use. The other is capacity building for practitioners like guidance counselors, clinical psychologists, and even classroom advisors. How to become advocates, how to become collaborators, no, contributing in their own means to prevent our children, our students from experimenting substance use, as well as investments on treatment and rehabilitation, reintegration, and of course the other less uh, featured approach is on research. No, I think research is really important because research should guide all the other approaches, all the other interventions that the government should be implementing. That's why I think Ma'am Shason had uh, given emphasis that everything that we should be doing should always be evidence-based or research research-based. So that is the context, no, of how serious the drug situation in the country despite the ravages of the pandemic, and how we should continue to strive, we continue to lend and volunteer our efforts, no matter how small, in the event or in the fight to win against substance use in the country. So what are the nature of clients? No? So what are the conditions of these clients? What are the challenges? What are the issues and conflicts? No? So in a way that if we can have a better understanding of these clients, we can be more equipped, we can be more able, how are we going to approach them, no? So it really starts with listening and understanding, so that we know exactly how are we going to react to these individuals based on the different and varying circumstances they are experiencing as a result of substance use or substance dependency, no? So uh, we are going to discuss the different drugs associated to substance related disorders. This is according to the DSM-5 manual, no? So we had actually touch this in our abnormal psychology subject, no, regarding these various substances and their biopsychosocial effects, no. So I will not elaborate each one of them, but just conclude, no, or as a whole, that all of this has a certain effect that influences the reward system, no? Yung reward system that creates pleasure or artificial, I'm going to say artificial pleasure, an instant gratification, no? So that's why I think there is what we call the addiction or the dependency, because it creates an artificial pleasure without much effort, without much hassle. So if you are faced with a difficult situation in your life, if you are uh, overwhelmed by pressure, so parang it's like they say it's a quick fix. No, it's the easiest way to is either to sort things out or to escape for a bit. No, and individuals who have no healthy outlets when they are stressed, when they are anxious, if they don't have hobbies, if they don't have meaningful employment, if they don't have activities that brings them satisfaction, then the lure of substance use is very attractive. That's why our children, especially if our children, our students, doesn't learn activities, doesn't have hobbies that brings out the positive outcomes out of themselves. We don't teach our children healthy coping uh, mechanisms, no? Just like Ma'am Shason had shared in the previous report, teaching her children to punch some throw pillow, no, as a way of healthy coping mechanism to a stressful situation. So if we don't teach our children, if we don't advocate our students to have healthy coping mechanisms, healthy adaptive behaviors, then and if these students are misinformed, no, misguided, then the lure of engaging into drugs is very high. No? So drugs is a quick fix. No? If students, if our children, no, they have no sports, uh, they don't engage in other uh, personality or potential defining activities, then the lure and the attraction to drugs will be that much that much higher. No? So that's it. So when we talk about substance related disorders, there are actually the two types. No? So the first is the substance use disorders. No? So when we say substance use disorders, this actually refers to the addiction or the dependency to the drugs. No, this will refer to the patterns of symptoms resulting to the use of substance, continuing to use substance despite experiencing problems. No, so we had defined a particular disorder when it starts already to impair your functioning. No, when it debilitates you in your daily tasks. You cannot perform your regular activities. You have disrupt. It creates disruption in your schedule. It wedges conflicts and constant misunderstanding with your relationship. But still, you continue to crave. You continue to use. Sometimes to great extent in order to gain access to these substances. So we can already say that there is the presence of addiction, no, or that substance use disorders. So that is the first type. The other is the substance induced disorders, no, including intoxication, withdrawal, no. So there is that uh, biological and psychological manifestation exhibited by your body because our body was conditioned. Our tolerance for these drugs had become so high that sometimes it creates that reaction, no, that forces us to ingest or to gain more. substances. No, that is what you call the withdrawal symptoms. No, and other induced mental disorders. So sometimes when our neurotransmitters, our body chemicals are so incapacitated by these substances, then it develops other psychological disorders, no, such as hallucination, uh, mood disorders, no, hypermania, and then followed by depression, sleep disorders, depressive episodes, and psychosis. So there is that dual disorder, no, the addiction disorder and the comorbid psychological mental disorders. No? So here is the vicious circle of drug use disorders. No, this is one. I had adopted this from one of the keynote speakers who had presented in the webinar. So you can already see, we can observe here the disruptive cycle of drug use, illegal drug use dependency or substance use dependency. No, what are the factors no involved that precipitates into the substance use? No, we have there the poverty, limited education on the harmful effects of substances, limited employment, limited opportunities. That's why they see substances not only as a means of pleasure and escape from their problems, but they also use it as a means of their livelihood. No, family and community conflict, poor interpersonal skills. So all of these things precipitate into drug use and drug use disorder. So this is based on the World Drug Report in 2020. We will now discuss the risk and protective factors for substance use disorder. So I think this is very important. No? So uh, the risk factors, these are already the deficiencies. When we talk about the risk factors, I think these are now the challenges. No? These are the needs. These are the vulnerabilities in the person. That's why he wasn't able to resist the attraction or the pull of the substance use. And that's why it's important that delve, we try to understand these various levels so that by understanding, we may now be able to use this awareness, use this knowledge, and try to come up with strategies, try to come up with approaches. How can we convert these risk factors during our intervention, during our counseling session, and turn them into protective factors? No? Convert risk factors into protective factors to enable the person to recover from substance use and strengthen him no, to avoid relapsing into a previous stage of substance use. No, so we have various levels here. The first, of course, is the individual level. So there is also that biological factor, genetic. No, so I think a lot there had been studies who had find out that if your parents or in your family line, no, there is that gene or that genetic trait that is somewhat vulnerable to addiction, no? Not necessarily a drug addiction, no? It can be alcohol, it can be nicotine, but any kind of addiction, then that that can be considered also as a vulnerability on your part. No, so sometimes it is good when we are going to have this assessment, no, family background, family constellations, we try to assess if there is the addiction in the downline of the family members. No, individuals who have prior psychiatric disorders. No, so individuals who have prior psychological compromises, no, people with anxiety disorders, people who are bipolar, or sometimes students with ADHD, they are actually more prone, no, they are actually more vulnerable to substance use, because in the first place their psychological makeup is already compromised, no, they have insufficient uh, personality and intrapersonal protective factors, no, so that is why na uh, if a person already has records of psychological problems before, then he or she will be more vulnerable, no, so somewhat related also, if this person has affective disorders, has problems controlling emotions, being impulsive, hostile. So those can be risk factors also. No, uh, deficits in social skills. No, if the person doesn't have the ability to communicate his problem, to talk to someone and try to sort things out, uh, personal challenges in a healthy manner. So the quick fix is through substance use. And personally, I had really experienced this one, no, na meron talagang mga tao na ang hirap para sa kanilang magkwento ng problema nila, no? Siguro naiisip nila na ayoko nang i-bother yung ibang tao sa problema ko, ayoko na silang gambalain, no? Siguro my parents are so busy, they have their own problems, ayoko na. So sometimes instead of reaching out to other people, sometimes instead of uh, asking for help, no, they try to do it on their own, no, and sometimes, unfortunately, their idea of solving problem is the quick fix or the quick solution, which is substance use. No, so that's why ito yung mga focus natin sa ating intervention, no. We build the interpersonal, we build the communication skills of the of our patient, no. So I have a friend of mine who we are constantly talking, no, lagi kaming nag-uusap, and then one day nagulat na lang ako na sinabi niya na bumili daw siya ng alak, and then naglasing siya mag-isa. So personally, I was shocked, no, parang nagulat ako, because ba't mo kailangang maglasing, no? Ba't mo kailangang maglasing ng to solve your problem, na in fact close naman tayo, no? You can be open with your problem, you can tell me your problem, but sabi niya, hindi na kita ginambala, no? Hindi na kita, I don't want to, ayoko lang dagdagan yung problema mo. So I try to solve it. Pero yun nga, parang it gave me a realization talaga na may mga tao talaga na they don't have the healthy outlet, no, they don't have the skills to talk out, they don't have, siguro yung iba may mga trust issues din, that's why they cannot start talking out about their problems. So instead, they just coop it up, no, they just try to suppress them further, and try to forget about it, escape it. Hopefully, when they wake up, no, kapag tapos na yung high, then siguro they are expecting that they will be more adept, They will be more capable to solve their problems, but unfortunately, that is not the case. No, so I think that is what creates the addiction. No, we these people are led to believe na the more you are going to take, the more they thought that they will be that it will solve their problem. They thought that it's going to give them confidence. They thought it going to give them solutions to their problems, but actually it just gave them more problems. So, yun, parang na-shock din ako na parang close kami, tapos alam naman niya na guidance counselor ako, no? I will not judge this person. I will be empathetic and everything. Pero, yun, parang, in a way, parang ano rin sa akin na parang he chose the company of alcohol over me. So, may mga tao talagang ganun, no? Na, and parang we have to understand that, no? As counselors, we have to respect that na hindi lahat ng tao kahit na gaano mo i-pour out yung sarili mo, gaano mo i-offer na gusto kitang tulungan, but if ayaw talaga nila or they don't trust you that enough, so wala kang magagawa, no? So that's it. Sa families, of course, no, these are the immediate circle after the individual. So, if there are issues in the family, no, if the individual had experienced abuse or excessive conflict, so sometimes quickest way, the quickest way to suppress conflict in the home, trauma for abuses, no? So without healthy intervention, so they just go to drugs, no? So wala ring communication, wala ring love and affection, wala ring support sa family. So usually they find that solace, they find that comfort with drugs. No? There are also certain families, no, that have positive attitudes, no, as in the case in other Western countries, I guess, wherein certain states have legalized marijuana, have legalized certain drugs. So, yun, if the family thinks that it's okay to use recreational drugs, then, that can be a factor, no, uh, in substance use dependency. Peer group, peer group. So, 'di ba sabi nga nila, tell me who your friends are. I will tell me who your friends are, and I will tell you who you are. Something like that. No, so I don't know if some of us here had experienced peer pressure. No, so sometimes there are individuals who sees their self-worth through conformity to others, no, so that's why there is what we call the peer pressure. They are pressured to conform because that will translate connection, that will translate into self-worth for themselves, no. So of course when you are associated to a bad company, then there is a tendency, there is a higher tendency for you to also imitate their bad habits and bad practices. The other factor, I think this is a uh, good realization that work and school can also be contributors to substance use. No, so I think the high pressure, the high expectations, sometimes that creates anxieties, no, especially for individuals who have poor management skills in terms of handling pressure. There are really some personalities who crumbles through extreme pressure, and these individuals, they sort to substance use in order to cope with the pressures, no? Whether this be at work or at school, no? Sometimes we have unrealistic expectations from our teachers, or this is commonly in the parents. So sometimes those were the triggers for substance use to cope up with pressures. And of course, the community itself, no? So if the community itself, uh, there is the access to substances, there is a positive attitude towards substances, there are very limited protective factors, protective measures. Law enforcement is not that comprehensive in that particular community, then that will be a contributing factor also for populations to develop substance use disorders. No, so these are the various levels. No, these are the various levels that as counselors we are going to examine. We are going to assess fully and carefully so that when we try to design a specific intervention plan, we can address the various risk factors in each of these levels, and how are we going to develop life skills that can translate the identified risk factors and convert them into protective factors. Okay, so they say the picture can paint, no? Picture can paint 1,000 words. So we can see here the physical manifestation, no, of substance dependency. No, this is just 8 months, 8 months of substance use, and we can really see that when you are into drugs, into substance use, it has the tendency for you to really neglect your well-being, no, as evidenced by this picture and also this picture. This is like a lifetime drug user. No? Okay, so I'm going to show, before we proceed, I'm going to show to you a video, no, regarding the substance use disorders in terms of symptoms, in terms of manifestations, in terms of conflicts, also in the context of the Philippine setting. And actually, in this video, uh, we are also going to discuss in brief already some of the interventions and first aid approaches that we are going to implement if we are beset by students or clients who are perhaps experimenting or using substances.
Ayon sa pinakahuling datos na inilabas ng Dangerous Drugs Board o DDB, umabot na sa 1,300,000 Pinoy ang gumagamit ng mga ipinagbabawal na gamot. Kaya naman nasa 3 bilyong piso ang ilalaan ng pamahalaan sa Department of Health para sa rehabilitation ng mga sumusukong biktima ng droga sa 2017. 5 beses na mas malaki kaysa 600 million budget na inilaan para sa taong ito. At alam mo ba kapatid, taong 2004 nang mailipat sa DOH ang pamamahala sa rehabilitation centers. Sa bisa ng Executive Order Number 273, inilipat ito mula sa NBI at PNP patungo sa DOH para matutukan at mapalakas ang rehabilitation ng mga nagumon sa ipinagbabawal na gamot. Itinuturing din ng ahensya na isang sakit ang drug addiction na nangangailangan ng masusing paggabay at gamutan. Bakit nga ba itinuturing na isang sakit ang drug addiction? Yan at marami pang iba ang ating uusisain mula kay Dr. Bien Liabres. Isa po siyang espesyalista sa addiction medicine at head ng Department of Health Bikutan Treatment and Rehabilitation Center. Magandang tanghali, Doc.
Magandang tanghali po, Miss Cosem.
Ayan po, para mas maintindihan po ng ating mga televiewers. Dok, unang-una po sa lahat, maaari niyo po ba munang ipaliwanag po sa amin ang kaibahan ng droga at ang ordinaryong gamot?
The drugs na sinasabi nating gamot ay para sa sakit, habang ang substances of abuse ay ginagamit natin for pleasure.
Ano po ang epekto ng mga sangkap na ito sa ating katawan?
Merong isang common area ng brain natin na tinatamaan sa paggamit ng droga. Ito yung, if I may use the more scientific term, the mesolimbic pathway. Ito yung pleasure pathway, the reward pathway ng brain natin. Now, habang na-expose ito sa droga, nagkakaroon ng changes tayo dito. Pag nagkakaroon ng changes, hindi na kasing pleasurable ng dati. At pag hindi mo na na-achieve yung pleasure, nag-a-adjust na rin ang body na kapag nawawala na yung droga sa katawan, nahihirapan na rin ang body natin. So those adjustments will make a person continuously take. Now, in some instances, itong changes sa brain natin na ito ay become so severe na nagkakaroon tayo ng tinatawag nating substance-induced psychosis. Ibig po sabihin, nagkakaroon na po ng diferensya sa takbo ng pag-iisip ng tao. For a small percentage of drug dependence, nagkakaroon sila ng mga hallucinations, nakakarinig ng kung ano-ano, at nakakakita ng kung ano-ano. Some of them may act on these hallucinations and do some things that normal people will no longer do.
Dok, pagdating naman po sa physical na anyo, ano po yung mga sintomas, mga senyales na dapat bantayan?
Ang makikita po natin, especially sa mga stimulant users or shabu users, ay loss of weight, malnutrition. You would see po dryness ng skin, dryness ng throat. At the same time also, you have to watch out. Tumataas ang blood pressure nila, tumataas ang kanilang pulse rate.
Kailan po natin masasabi na nagugumon o na-a-addict na po ang isang tao sa ipinagbabawal na gamot?
So kung naka-stimulants po sila, halimbawa po itong shabu, ito isa sa very common sa atin. Pattern po yan na makikita nyo, very hyperactive sila, makulit, galaw ng galaw, hindi makapagtulog ng maayos, walang gana kumain, tapos unti-unti pong namamayat itong mga to. And then after that, it's a pattern, hyper na hyper, susundan siya ng a day. After one day, magiging matamlay naman sila, gutom, tamad, gusto lang makapagtulog.
Telltale signs naman po ng drug addiction.
Sinabi na nating addicted na siya, nagkaroon na ng changes sa brain. So from a user, like an experimental user and occasional user, they become a drug dependent. Once they are a drug dependent or addicted na po sila, nagkakaroon na tayo ng changes sa brain. Napapansin niyo, they will just take drugs just to feel normal. Hindi na ganun
Yun na ang
katama.
normal sa kanila.
That is their new normal.
Oo.
But at the same time, nagkakaroon na rin ng deterioration. Pag nawawala naman ang tama, yung kanilang feeling of normal sila, nagiging mainitin ang ulo, nagiging palaaway, walang ganang makipag-interact sa kung kani-kanino, nasisira na rin yung mga social and functional activities nila.
Ano po ang tamang approach sa gamutan po ng isang drug addict?
Dalhin niyo po sa isang doktor, preferably isang addiction medicine specialist o isang psychiatrist or isang psychologist para malaman natin kung gumagamit ba talaga siya. At kung gumagamit siya, gaano kalalim na yung paggamit niya. And from there, you have many different options kung paano on how best to deal with that patient.
Meron ding parang outpatient type and then meron po yung ipapasok nyo talaga sa isang rehab center. Ganun po yun?
Kung siya ay isang experimenter lamang, occasional user, they are best sent to an outpatient program. Sa outpatient program po, hindi naman sila kailangang nakakonfine. Ngayon, kapag hindi na nila kayang kontrolin ang kanilang paggamit sa droga, naaapektuhan ng kanilang pangangatawan at pag-iisip, then that's the time po that we will recommend na ipasok sila sa isang drug rehabilitation center.
Gaano po katagal ang gamutan nito?
There's no specific time frame. It depends on how a patient will react. Pero in general, ano po, kung sinasabi natin ipapasok sa isang rehabilitation center, ang kadalasan po niyan is between 6 months to 1 year.
May mga nagsasabi po, Dok, maririnig nyo na, naku, pag addict ka na, habang buhay na yung addict, babalik at babalik.
Addiction is chronic and a relapsing disorder. Maaari pong magpabalik-balik yan. Some may relapse once, twice, maybe even more than that. It is important for the therapist to see kung ano ba talaga yung mga factors na nagkukos ng relapse. And then kung ma-address lahat ng factors, you get a better chance of a successful rehabilitation for the patient.
Dok, huling paalala na lamang po sa mga manunood natin na may kilalang nalululong na po sa ipinagbabawal na gamot.
Una, kausapin ninyo ng mahinahon. Alamin ninyo kung ano ba talaga yung mga circumstances, kung sila ba talaga ay gumagamit, at kung sumunod niyan ay ipasuri ng maayos. Huwag ho kayong magpapanik. Hindi ho lahat ng user ay nangangailangan talaga ng rehabilitation. They can be helped on an outpatient basis. They can be helped through counseling. They can be helped through psychoeducation.
Dr. Bien, thank you for joining us.
Thank you very much din po for inviting me. It is my pleasure.
Mga kapatid, lagi po natin isaisip na walang magandang maidudulot sa atin.
Okay, so we had witnessed that video, regarding uh, the nature as well as the symptoms of substance use disorders in the context of in our country. And I think it's really important, that we are going to advocate this information, because a lot of I think one of the contributing factor also of that is why the drug problem in the Philippines is worsening because of the lack of education, the lack of education regarding the struggles, regarding uh, the difficulties experienced not only by these individuals but at the same time also their families. So this is the difficult reality about substance use users and dependents. Addiction is a disease that makes you too selfish. Sometimes the client, because of the imbalances in the chemicals, imbalances in the cognitive functioning, sometimes they lose their awareness of themselves. All their focus is more on that pleasure uh, aspect of the substance use. So they become unaware of the chaos, the what do you call this? The harm that they had allowed themselves, or they had uh, attributed themselves or for their bodies to suffer, as well as to the people, the shattered relationships that they had brought upon to the people that they are into, or the relationships. So we can really see that substance use disorder is a really serious problem that requires our immediate attention and our cooperation in order to save our students, save our children, and help them uh, resist the false promises of substance use. So uh, on the study by Hongsma, in 2014, so he was able to give behavioral descriptions of substance use in the school setting. So this various red flags is also somewhat similar to what we had observed in the video that I had shared, no, the physical symptoms of withdrawal as well as the affective and psychological symptoms. And that is why it's very important that as guidance counselors, as advisors, as educators in our schools, it's important that we are keen enough of these red flags in our students. No, because I think it's very important that, of course, prevention is always better than cure. No, so it's important that we advocate sufficient education to prevent. That's why it's called preventive education, to prevent from the experimental use of substance. But at the same time, early intervention is also better than late intervention or rehabilitation. No, so if we think that based on these red flags, we are suspecting that these students are engaged into substance use or in some way involved into the drugs trade. No, so it's important that we uh, employ concrete steps to intervene. No, counsel the student. No, try to reach out to the families. No, because sometimes I think because of misinformation, because of the stigma we attribute to substance users. So that's why na instead of encouraging them to uh, avail treatment, parang because of the stigma, parang they tend to not only avoid treatment totally, but they induce more drugs because we are pushing them away. We are discriminating them. And I think certain families, certain families again because they are also misinformed, their approach to their children who are into substance use, instead of being emotionally supportive, instead of being understanding, no, and trying to peacefully communicate to the children, to the student, what is the problem, just like in the video that had advocated na mahinahon na kausapin. So sometimes uh, the approach that we do na parang pinapagalitan pa natin, no, talagang binubugbog, no, or sometimes uh, lalo na ngayon, no, parang natatakot tayo na kapag nag-avail tayo ng treatment, baka maisama tayo dun sa mga, summary executed or whatever. So it creates that stigma of availing treatment, no? So yun sana yung ating i-goal, no, na aside from counseling our students, we also counsel our parents, no, and us counselors and educators na mas magiging positive yung ating approach, mas magiging understanding, no? Me as a Rogerian counselor, talagang you're going to extend the most unconditional love and support for this student, for this client, no, so that uh, we can properly reach out to this person and find out what is the real problem, no, because substance use is not, some more often than not, this is not the real problem. There is an underlying problem, and I think we can go back again to the risk factors that I had mentioned earlier, no, as the etiology for substance use, no. So overall, I think guidance counselors and mentors, we are in a very important position. We are in a very influential role that we can really use, no, to help students avoid or refrain from using substances. So the important consideration, no, take note that although when we talk about substance use, they have similarities in symptoms, they have similarities in their challenge and difficulties, but it's always, let's not forget that it's always different for an individual, no? Iba-iba yung kanilang pinanggalingan, iba-iba yung kanilang mga ah, iba-iba yung kanilang mga perspectives why they use substances, no? Iba-iba rin yung kanilang patterns of substance use, and that's why na there should not be an generic treatment, no? That's why we have to assess them, we have to see them uniquely as it is. No, we have to really understand them fully so that in a way we can also design the most appropriate intervention based on the needs, the challenges, and the risk factors identified to this specific client. So that ends our my first segment of my presentation. No, so uh, we can start our first session of sharing thoughts, no? So siguro we can start on the risk factors, no? What do you think are the most influential risk factors for you, no? Based on your experience, no? Is it really more on the individual? Is it more on the peer influence, or is it more about the family, no? So have you encountered students or clients with substance use difficulty? So this doesn't have to be drugs. It can also be alcohol. It can also be nicotine or tobacco. Uh, what was your reaction when you had encountered a student who had attended your class drunk? No, so uh, how did you address that situation? No, so personally, this had happened when I was an instructor. No, so I had my students are HRM. No, so HRM students, and commonly HRM students have this bartending classes. So sometimes uh, papasobra yung inom, and sometimes pumapasok lang talaga sila na siguro galing sa sessions, and uh, my reaction to that is that nung pumasok sila, I think this was a group of uh, three males, no, and usually sila talaga yung pinaka what to say, pinaka different from class. Sila yung talagang may conduct disorders usually. No, so when they attend my class, no, and talagang you can smell the presence of alcohol, no, in fairness, nagpa-good morning sila. So for some reason, I didn't react harshly, no, even though it's very obvious that they are intoxicated, no, but I didn't react in a harsh manner, no, na talagang nagmura ako, and ayun, so I just asked them to uh, go at the back, no, sit down, and then try to pay attention, or if not, then try to wag lang magingay and wag lang manggulo sa klase. So ganun lang. That's how I approach it, and then I explained later, sinegway ko lang na uh, I am not judging you for whatever your actions, sabi ko sa kanila, and that's totally up to you, no? I do know that there might be problems. I don't know kung whatever made you to uh, what pushed you into this particular drinking session, but I do hope that uh, as you go along, no, you'll be more responsible, you'll be more accountable to your actions, no, because and all hopefully na uh, you will be more appreciative, no, of the opportunity to study. So that's how I approach it, no, the Rogerian way. And good thing is that that incident had never happened again, and those boys who had conduct disorders had actually improved after that particular incident. So that's the only experience that I can share, no, with clients who had substance use disorder or substance use problem. Okay, so thank you, classmates. I do hope that we can have a productive sharing. And after this, I am going to continue with my report. Thank you, everyone.